Hello, my name is Molly Tolins. I'm an emergency medicine physician, and I'm a graduate of University of Washington Emergency Medicine Program in 2018. And what am I doing now? So I left residency in 2018 as a graduate. I didn't leave early. And I did a one-year fellowship in patient safety with Kaiser Foundation Health. And during that time, I per diemed or I pooled with the Permanente Medical Group, or Kaiser Permanente in East Bay, so in Oakland and Richmond. And during that year, I was able to explore many different topics, physician well-being, burnout, secondary trauma, all passions of mine that started during my time at University of Washington. And after fellowship, I stayed on as an attending physician in the East Bay in Oakland and Richmond, where I'm able to experience so much amazing clinical care. So high acuity medical care, folks on chemo, folks with transplants, really sick patients, heart disease, heart failure. We do a lot of resuscitations. And in Richmond, we also experience a population that's much more underserved. Many of them don't have health care or insurance or primary care physicians. And we see a lot more trauma there as well. So I have a lot of diversity of practice and a lot of amazing opportunity to apply the skills that I learned in residency to all of these different areas and to work with a community of patients that I really care about and that I live in this neighborhood. I work in these neighborhoods, and it's something that I find brings me a lot of joy and meaning to really support the communities in which I live. And it's a really amazing community of patients. And along with the clinical care, I've been able to step into a little bit more of almost an admin role. I run a program called POST, which is Peer Outreach Support Team, which is a peer support program that trains physicians, so attending physicians, as peer supporters, and then helps them and supports them in supporting their colleagues. Because we all know we have difficult experiences as attending physicians, as residents, anyone in medicine. You're with people during their most difficult times of life. And it's really important to me to support people through that experience, to make sure they have the space, the time to unpack some of that trauma, not just compartmentalize it. And it's something that's been a passion of mine since probably third year of residency, was fostered at University of Washington throughout my fellowship. And now as an attending, emergency medicine attending, I'm able to really explore that further. To run this program, both in our local hospitals. I work in two different hospitals in Oakland and Richmond, but also regionally across the Northern California region of Kaiser Permanente. So it's been a really, really exciting part of my career to not have only just the clinical care, which I love, and I love going to work, and it's so important, and I think it's a really wonderful career. And I work in a great group of people in an amazing community. And I feel very well supported. So I love that part of my job, but I get to complement that with non-clinical work, which goes so hand in hand with the work that we do with the occupational hazard of burnout, secondary trauma, and compassion fatigue, and allows me to really support my colleagues, support myself, continue to connect to our humanity as we do this really important work. So that's what I'm doing now after I graduated from University of Washington a little over 6 years ago. And I couldn't say highly enough how much University of Washington set me up to pursue this career and to feel so satisfied in doing what I do today. How did UW get me to where I am now? I can't thank UW enough for launching my career. I really can't. I mean, let me start with the clinical experience. I was so well prepared to be an attending. I came out of residency feeling strong, feeling confident, not overconfident, but confident. And I launched into my career in a really busy emergency department. I actually work in two separate hospitals, extremely busy, high acuity, a lot of medical complexity as well as trauma. And I felt so well prepared to tackle basically anything that walks through the door. We have a ton of pediatric patients. We have a ton of pediatric pathology. We have a lot of geriatric medicine. We have a lot of in between. And we have real medical complexity where I work at Kaiser Permanente. We have, transplant patients, heart failure patients. We have many, many resuscitations on a daily or weekly basis. And I just felt like I was really well prepared to walk into those shifts and feel confident and feel like I knew what I was doing and to be able to handle all the different aspects of emergency medicine. But UW also launched me in a different way. And again, I already kind of mentioned this a little bit, but my passion really lies in taking care of our physicians. And what I mean by that is we often are there with people during their worst moments of life, very difficult experiences, helping people through new diagnoses, through end of life care, through losing a loved one, through learning that their life is going to look different than they thought the day before, the hour before, that morning, etc. And through our empathic connection, which we all love, right? Like many of us went into medicine because we wanted to connect with patients and support them and be the person that could help them through these difficult times. But because of that empathic connection, we're also suffering. We feel those emotions as our own, and we start to really internalize them. And I myself, during residency, post-residency, during fellowship, during the first years as an attending, I started to notice that I really was suffering. I was withdrawing a little bit from that empathic part of myself and protecting myself from some of those feelings. And that's not the kind of physician I want to be. And that's not the kind of physician that I think many of us want to be. We want to be able to feel and to connect and to empathize without depleting ourselves. And so my passion really lies in that. And how do we support each other? How do we prevent the burnout, the secondary trauma, or at least manage it, handle it as an occupational hazard once it happens, which it inevitably will. We're there during really difficult times. And I started to really think about this in residency, probably in my beginning of my third year, throughout my third year through my chief year. And I had so much amazing mentorship, so many attendings who were interested, who were passionate, who were able to lead me to different connections, help me think about how do I even research this? How do I think about this? I wanted to start a storytelling event, which we ended up calling Emotional Alchemy Storytelling Events, which are ongoing at University of Washington to really help residents get together, to talk about these things, to share their experiences, and to support each other through them so that we're not just constantly compartmentalizing, but we're able to process. And I had so much support in doing that from our leadership, from our program director, Fiona Gallahue at the time, was really supportive of this and really helped us make this happen. And then my grand rounds as a fourth year as a chief resident was on secondary trauma and burnout and all of the factors that came along with it, and had mentorship in creating that and researching that and really starting to think about that. And that was my launching pad for my fellowship, where I was really able to explore further these topics, to think about how do we address them, how do we build a safety net or a program or a resource that really helps support our physicians through these daily traumas. And I was able to, a little bit during the fellowship, but after the fellowship, as I became an attending physician with the Permanente Medical Group and Kaiser Permanente, where I now work as an attending, I was able to really focus on these topics as a professional avenue. So as part of my career, I built it into my career. And I now run our regional program, which is POST, Peer Outreach Support Team, that allows us to support each other. So we train physicians. We have a team of physicians who are peers, but also with an additional level of training who can support their colleagues through these difficult experiences. And it's such an important avenue of my career that I can focus on, that I can be passionate about alongside the clinical care that I really love, that I really care about. And UW really prepared me for both. And I think the way UW prepared me for both is amazing clinical experience, breadth of experience. The stories out of residency, I saw everything, right? 5 states worth of trauma and medical pathology. And I just, it's hard to even put into words the breadth of experience, the amazing clinical exposure I got in residency. I was so prepared to be a clinical emergency medicine attending But at the same time, there's so many passionate people, so many amazing attendings at the University of Washington in our emergency medicine program that I was able to foster these additional interests, these additional passions. And I felt like that was part of what made an amazing emergency physician, because everyone around me, all of our role models, they were thinking about so many different things. There were so many things going on. And not to say, of course, some of the attendings, their focus was clinical care, but there was also attendings focused on research and attendings focused on education. Of course, all of them, at least in part, focus on education, but there's so much going on there that it really sparked in me a passion to explore other topics, to think about what my career could look like outside of, not just clinical work, but what I wanted to do, how I wanted to make changes. Did I want to focus just on clinical work, or did I want to do something else? And University of Washington really allowed me to explore that. And I can't thank all of the attendings, the program, enough, because it really changed the way I'm able to practice medicine, to be a holistic practitioner, to think about, all the different parts of medicine that impact me as an individual. And I'm so happy that I have this other part of my career to focus on as well. Peer support, physician support, well-being, that allows me to really explore all the different parts of me as a physician. And it allows me to come to work so happy to be there, and just so immersed in being able to connect with patients and keep that part of my humanity while also providing clinical care. And that all really started at University of Washington, and the fostering of those excitements, of those passions, allowing me to think outside the box while also becoming an amazing, skillful, well exposed to the breadth of medicine, emergency medicine attending. So I'm really grateful to University of Washington for allowing me to do that. What was special about University of Washington, and what was special about your residency? Is there anything in particular you'd like to share? It's so hard to pick out of so many different kinds of experiences. University of Washington was such a unique training program. And, now that I'm out in the world and I've met so many different people from different training programs, and we kind of compare and we share stories, obviously there's things that are similar to other residencies. We get great trauma exposure. We get great medical exposure. We have community sites. But I think what's really unique about University of Washington is the sense of community. Harborview really is seen by the community as this hospital, this community of healthcare providers that really cares for the community. And not just Seattle, but the entire community, the 5-state region, the WWAMI region. And so I really felt this sense of passion, here I am as this provider, part of this team of great doctors and residents and, nurses and techs and RTs. Everyone was there caring for the community. And that felt really special. It's not just the breadth of experience that I received, but the fact that I was part of this organization that really cared, that really helped support the community and care for everyone. And that was something that was really important to me. And then beyond that, I think what's really important to recognize at University of Washington is your clinical exposure is outrageous. It just is so good. And, I talk to my colleagues now who train at different programs, and of course, everyone has their stories, and you get good training wherever you end up. But I think University of Washington, we have Seattle Children's Hospital, we have the University of Washington, which is tertiary care. You see, patients with transplants and medical complexity on chemo, et cetera, really sick medical pathology there. And then Harborview, the level of trauma you see there, in my opinion, is it's on a different level. You get 5 states worth of high-level trauma. And as a second year, even, you're running the trauma side as the trauma doc, obviously with support, but you really get that kind of exposure where you're in there taking care of really sick patients and working alongside surgeons, residents from all different specialties, expert consultants, and you're able to really glean just an amazing amount of clinical knowledge from that experience. I really feel like University of Washington prepared me to work basically anywhere. I mean, I think I could work in a rural place. I do work in an urban place. I see trauma, I see medical pathology. But University of Washington, there are so many varied experiences and so many opportunities that you really can go from there to basically anywhere. And the other experiences that I think are important to call out are, we have a burn center and you rotate there as a resident in the burn ICU, which is a really unique experience. And now as an attending in a community hospital, when I see burn patients, I feel much more comfortable than some of my colleagues. So I think that's really important to call out. But more than all of that, clinical exposure, feeling like really confident coming out of residency, which I think you can get other places, or I think University of Washington does it really well. What I really want to call out, what I think is so unique, are the people at University of Washington. Our emergency medicine program is just studded with excellent clinicians and people who are passionate about so many different topics. You can find mentors in any different area, and they're willing to just sit down with you as a resident, talk with you, lend their expertise, work on projects with you. And it really sparked in me a passion for not just clinical care, not just going to work and punching a time card and doing a shift, etc., but really finding a way, like, how do I sustain myself in this career through these other passions?
Brilliant.
And so for me, I came out of it with a love of clinical care, a strong clinical background. I feel very, very prepared as a attending physician in emergency medicine. But on top of that, I had all these other interests and all these other sort of passions that got sparked in me to think about, what do I want to do outside of medicine? Do I want to have, do I want to have an admin hat? Do I want to do program management? Do I want to look at the business side of things? And I found that to be really exciting. And that's something that, I think many residencies probably offer, but it was just amazing at University of Washington. The number of excited, passionate people who could really help you in any area of interest that you wanted to explore. And I still have mentors from University of Washington that I text or I call or I ask for advice because I lean on them, and they're really, really amazing mentors. And that's something that, again, probably exists in other residencies, but I think it just in abundance at University of Washington, you just had so many people who are willing to help and willing to support you in whatever kind of endeavor you wanted. And I found that to be one of the best parts of my residency training, is being able to explore topics that I wanted to explore with the support of my mentors, of my attendings. And it's led me down a path of, this program, this peer support program that I run. I've published on it now. It's something that I find really exciting, and it complements my clinical care in a way that just makes me so excited for every part of my work. Like, I get to go to work, I get to do this amazing work, I work with amazing colleagues, and then I get to support those colleagues, down these other avenues as well, through peer support, through storytelling events, through well-being initiatives. And I find that to be really exciting and really kind of the best part of my job. And that all started at University of Washington because I had the mentors and the support that I needed to think outside the box and to understand what else might be possible in emergency medicine. So I truly think University of Washington made me the doctor that I am today, both in clinical expertise, in my confidence, and in the way that I'm able to explore additional topics as well. So I couldn't be more grateful to the team at University of Washington. I also couldn't recommend the program highly enough. And I'm so grateful to be where I am today and to have had the experiences I had at UW during my residency training.